The cumulative total of confirmed COVID-19 cases in the United States increased to over 46.3 million on Thursday, with the death toll surpassing 751,000, according to data released by the Center for Systems Science and Engineering, CSSE, at Johns Hopkins University. Specifically, the country's case count rose to 46,332,253 as of 1922 Eastern Daylight Time, EDT, on Thursday, and its death toll reached 751,514, the CSSE tally indicated. According to an estimation from The Washington Post, if the loss of lives in the U.S. could make up a state, it would be more populous than Alaska, Vermont or Wyoming. The latest death toll also means that the country has been losing an average of around 1,200 lives per day since the onset of the pandemic, according to Forbes. Despite the dire situation, the U.S. has been widely criticized in its swaying anti-epidemic policies. According to a report on The Atlantic, the recent confusion began with the targeted crowd for booster doses. The Biden administration first floated boosters for everyone to combat breakouts, but then a CDC advisory panel narrowed the list to the elderly and immunocompromised most at risk for hospitalizations. Later, the CDC overruled the previous decision and included those working on positions that pose risks of infection, said the report. Joseph Allen, a Harvard professor of public health, slammed the ever-changing policies, saying that, "We're sleepwalking into policy because we're not setting goals." On Thursday, the U.S. government rolled out a new policy mandating those working at companies with 100 or more employees to be fully vaccinated before the deadline January 4 or get a test per week. The latest requirements will apply to roughly 84 million workers. Although it is not clear how many of them have already taken the jab, still, enterprises would be placed under huge pressure to get all their workers covered in merely 2 months' time.